This last forwarded email says there's a new stroke indicator to be aware of, and it's the tongue. If you suspect somebody is having a stroke, ask them to stick out their tongue. If it's crooked, goes to one side or the other, it could be a sign. Send this to 10 people to save a life. What do you think?
Don't send that to anybody because you won't save any lives. You will hurt people potentially.
No.
So what happens with a stroke is blood flow to the brain is cut off. And as a result, those brain cells aren't getting adequate oxygenation, and that causes the brain cells to start to die. When it comes to a stroke, you want to remember the acronym FAST. If you see facial drooping, arm weakness, or speech difficulty, then it's time to call 911. So that's what you really want to pay attention for, not the whole tongue thing.
I mean, the doctor will ask you to stick out your tongue. He does that to get a good look at the back of your throat.
Yeah.
A neurologist will have you stick out your tongue to test one of the cranial nerves, hypoglossal, the 12th cranial nerve.
Yeah.
You want that tongue nice and straight. Can you move it to both sides? But this is way too sophisticated to try to do on it. You don't have time for that. If the things that you mentioned, facial, the changes in speech, you want to act fast.
Yeah. Think fast, act fast. You know, I know there's so many situations where people wait too long and it could be the difference between life and death.
Big time. And their medications, if you catch certain types of strokes early on, the outcomes are significantly better. So that's a great tip.